Hello, my name is Tina, and today I'm going to teach you a little bit about cardiomyopathy. Cardiomyopathy is a subacute or chronic disease of the cardiac muscle. Cardio meaning heart, myo meaning muscle, and pathy is disease of, or in layman's terms, disease of the heart muscle. So here we have the different types of cardiomyopathy. Dilated, where one of the ventricles of the heart is enlarged. Hypertrophic, the most common, and therefore our main focus, and this is where the heart muscle is thickened. Arrhythmogenic, which causes irregular heartbeats or rhythms. And restricted, where the heart muscle is stiff, scarred, or both. Yikes. Here we have a picture that does a good job of illustrating the anatomical changes in the heart that you would see in hypertrophic cardiomyopathy. Notice the thickening of the myocardium surrounding the left ventricle. This is the one time where gains are not the goal. For the next picture, women, children, and those of you with weak stomachs, avert your eyes. So here we have a side-by-side of two very different hearts. On the left, we have a normal heart weighing 375 grams. On the right, we have a heart with hypertrophic cardiomyopathy weighing 550 grams. And oh my God, look at the difference in size. That is disgusting. How can anyone live like that? It's important to know who this affects and the risk factors for it. Because cardiomyopathy often goes undiagnosed, the numbers can vary, but it's estimated 1 in 500 adults have it. It's more commonly seen in those with a family history of it or heart failure, and those with connective tissue or autoimmune diseases, pregnancy, or long-term alcoholism or cocaine abuse.
All right, stop. Collaborative interventions. The nurse is in to give you some education. Getting a proper diagnosis for our patient can improve outcomes and determines appropriate interventions. It is important for the nurse to complete a thorough assessment and work closely with the doctor to ensure a timely and adequate diagnosis. You should report all findings to the physician. So many different diagnostics and tests available. OMG. Chest X-ray, EKG, echocardiogram, cardiac catheterization, endomyocardial biopsy, pulmonary function tests, pulse oximetry and ABGs, BUN, creatinine, serum electrolytes, cardiac enzymes, LFTs, BNP, CBC, TIG levels. Give me all the blood. Interventions are aimed at preventing fluid overload, increasing cardiac output, and observing for signs of respiratory involvement. Strict INOs, medication therapy, heart monitors, pulse oximetry, and frequent assessments are your friend. Do not get sidetracked and forget to check on your patient. They need you. Communication and collaboration between the doctor, pharmacist, nurse educators, surgeons, and family or caregivers is vital to the longevity and compliance of the patient.
Welcome, brothers and sisters. This is Stone Cold Nate, coming at you with some hard-hitting facts about pharmacology. As you learned from Tina, aka El Presidente, the rock of the class, cardiomyopathy has 3 main types: dilated, restrictive, and hypertrophic. Both DCM and restrictive cardiomyopathy present with CHF symptoms. These hard-hitting, heart-hating pathologies can be managed with their ACE inhibitors or beta blockers, calcium channel blockers, digoxin, and diuretics. Oh yeah, brother. Focusing on hypertrophic pharmacology, the 2 main classes of meds that we will use is our beta blockers and a little bit of calcium channel blockers. Now these medications are gonna decrease the outflow obstruction that accompanies exercise. Sounds like we can pump some iron. They're gonna also decrease the heart rate, resulting in less angina, dyspnea, and syncope. Oh yeah. Listen up, class. We will not, cannot, held to the no, administer any vasodilators, diuretics, nitrates, and cardioglycosides, as vasodilation and positive inotropic effects may worsen the obstruction seen in HCM. Oh no, brother.
Hey everyone, it's Heather over here again. Now it's time to go over pacemaker types and settings. For types, we have temporary or permanent pacemakers, which are devices that provide electrical stimulation to the heart to maintain a sufficient heart rate. Temporary pacing is a non-surgical intervention that provides a timed electrical stimulus to the heart when either the impulse initiation or the conduction system of the heart is defective. And these types include transcutaneous pacing and invasive or transvenous pacing. Now let's talk about permanent pacemakers. These are surgically implanted into a sub-Q pocket below the clavicle. The leads are passed transvenously via the cephalic or subclavian vein to the endocardium on the right side of the heart. These pacemakers are indicated for conditions such as complete heart block. Now let's cover the 3 pacemaker settings: synchronous or demand pacing, asynchronous or fixed rate pacing, and overdrive pacing. Synchronous only kicks in when needed, asynchronous continuously paces for the patient, and overdrive pacing suppresses dangerous underlying rhythms.
Stone Cold Nate back to talk about ICDs. An ICD is a small battery-powered device that electrophysiologists implant under your skin in your chest or abdomen. Now, these ICDs can treat life-threatening dysrhythmias, i.e. VTAC and VFib. Now, the ICD has 4 main parts: a pulse generator, 1 and 2 leads, electrodes, and a battery. Now, this system allows electrical pulses to be sent to your heart to shock the heart back to a normal rhythm. Pretty outrageous stuff.
Everyone, Annabelle here to give you some info on pacemaker client education. The first thing you want your patient to know is the program rate of their pacemaker, which is the number of impulses delivered per minute to the atrium. It is also very important in teaching your patient the signs of battery failure, such as lightheadedness, palpitations, or a hard time breathing. Another thing you want to inform your patients of is when passing through security detectors such as the one at the airport, you need to inform your patients that they may set off the alarm, so to notify security beforehand. Also, electrical appliances tend to not cause any interference, but to be on the safe side, to not operate directly over the pacemaker site. Now to talk about client education regarding cardiomyopathy. The number one thing is tell your patient to stop eating so much salt. Tell them to stop adding so much salt to their tacos and their burritos. It is also very important that they be as active as possible. Tell them to start walking and take their dogs out for a walk. They're tired of being inside the house. Also, it is very important that your patient limit how much fluid they are having each day. The healthcare provider will provide a safe limit. Also, they need to take their medications exactly as directed, not skipping any doses, and to avoid taking over-the-counter herbal supplements because they tend to raise the heart rate or blood pressure. And finally, inform your patient that they should call their doctor right away if they experience weight gain of 2 pounds in a day or 5 pounds in a week, if they have chest pain that doesn't get better with medicine, trouble speaking, or new or increased swelling in their hands, feet, and ankles.
Hey everyone, Heather here with some information regarding psychosocial issues for our patients with pacemakers. As healthcare providers, it's essential for us to be knowledgeable on how to educate our patients as well as provide emotional support to them in times of need. So let's get started. Some diagnoses for patients who are going to or have pacemakers are fear, disturbed body image, anxiety, and social isolation. Having a pacemaker placed can be very daunting and intimidating, so it's important that we assess these patients for any signs of psychosocial problems. Some nursing interventions to implement for our patients are to assess their support systems, their feelings of self-worth, and their ability to communicate. We also want to monitor the patient for signs of denial or withdrawal. Our ultimate nursing goal is to have our patients as educated about their condition as possible and to ensure that they have the proper psychosocial support to live the happiest and healthiest life that they possibly can. Thank you so much for watching, and don't forget to take the free quiz at the end of the video, and also don't forget to subscribe to our channel.